According to recent data, the prevalence of childhood obesity in the US has been alarmingly high. The CDC conducted a survey which estimates that in 2017 to 2018, approximately 19.3% of children and adolescents aged 2 to 19 were affected by obesity. Even so, obesity rates vary across different demographic groups, with certain populations experiencing higher rates of obesity than others. Childhood obesity is associated with numerous short and long-term health consequences. Obese children are at a higher risk of developing chronic conditions such as type 2 diabetes, cardiovascular disease, asthma, and sleep apnea. All of this can translate into adulthood as well. Changes in the built environment, such as increased availability of high-calorie foods, sedentary behaviors resulting from excessive screen time, limited access to health foods in certain neighborhoods, and decreased opportunities for physical activity all play significant roles in the rise of obesity. Addressing childhood obesity requires a comprehensive and multifaceted approach. Nurses need to examine epidemiological data to determine the prevalence of childhood obesity and identify trends over time to understand the magnitude of the problem and monitor the changes in obesity rates. The Journal of the American Medical Association did a study on the prevalence of obesity over the years 2003 to 2012 and found that overall, there have been no significant changes in obesity prevalence in youth or adults between 2003 to 2004 and 2011 to 2012. Obesity prevalence remains high, and thus it is important to continue surveillance. Epidemiological studies provide valuable insights into the risk factors and determinants associated with childhood obesity, which nurses can use to assess individual children's risk profiles and identify modifiable factors. Common risk factors include unhealthy dietary patterns, sedentary behaviors, low socioeconomic status, genetic conditions, and limited access to healthy foods and recreational facilities. Epidemiological data highlight the health consequences associated with childhood obesity. Nurses can utilize this information to educate families and communities about the potential short-term and long-term effects of obesity, including the increased risk of chronic diseases, psychological impacts, and reduced quality of life. Understanding the health consequences helps in emphasizing the importance of prevention and early intervention. Financial, policy, and regulatory issues are significant factors that surround the population. These factors can influence the prevalence, prevention, and management of childhood obesity in the U.S. For example, childhood obesity imposes substantial economic burdens on individuals, families, and the healthcare system. The direct healthcare costs associated with obesity-related conditions are substantial, as studies conducted in the U.S. found that in a lifetime, direct medical costs for a 10-year-old child with obesity versus the one with healthy weight ranged from $16,000 to $19,000. Nurses need to understand the financial implications of childhood obesity to advocate for resources and support systems that address prevention, screening, and treatment. Adequate health insurance coverage plays a vital role in ensuring access to obesity prevention and treatment services for children. Nurses should be aware of the policies and regulations that determine coverage for obesity-related services, including screenings, nutrition counseling, and weight management programs. Priority concerns for nurses highlight the areas where nursing interventions can have a significant impact on reducing health disparities and promoting equitable health outcomes. Lack of awareness and knowledge about healthy lifestyles and the consequences of childhood obesity can lead to health disparities. Nurses play a crucial role in providing health education to children, families, and communities. It is said in a study done by Global Health Pediatric that the only way to fight childhood obesity is to educate families and then to implement the education. By offering culturally sensitive and age-appropriate information, nurses can empower individuals to make informed decisions regarding nutrition, physical activity, and overall health. It is also important to address socioeconomic factors such as income, education, and social support as they significantly influence obesity rates. To effectively evaluate population health disparity concerns related to childhood obesity, quantitative analysis allows for the systematic examination of epidemiological data to assess disparities. Analyzing existing data sets can be recommended, such as national surveys or local health department records, to examine obesity prevalence rates across different demographic groups. By comparing obesity rates among subpopulations such as racial or ethnic groups, socioeconomic strata, or geographical regions, disparities can be identified and the magnitude of the issue can be quantified. Another option can be educating health outcome indicators specific to childhood obesity. This includes BMI, prevalence of obesity-related conditions, and psychosocial well-being. By comparing these indicators across different population groups, we can assess the disparities in health outcomes and understand the differential impacts of obesity on the different populations. Combining multiple evaluation methods provides a comprehensive understanding of population health disparity concerns. In conclusion, the utilization of epidemiological concepts has been instrumental in identifying and understanding population health disparities in childhood obesity. The epidemiological data examined in this presentation has provided a comprehensive picture of childhood obesity in the U.S. Prevalence rates, risk factors, and health consequences have been carefully assessed to highlight the disparities that exist among different demographic groups. The knowledge gained from this analysis allows for targeted intervention that addresses the root cause of disparities, promotes health equity, and improves health outcomes for all children, irrespective of their socioeconomic or cultural backgrounds. By focusing on prevention, education, advocacy, and collaborative efforts, we can work towards a future where all children have an equal opportunity to grow up healthy and thrive.